Welcome back to First Aid to Lifestyle with Dr. Kumail. Today we're starting in my medical office, ready to help you take charge of your health. Tick. Every 2 seconds, time claims a life lost to a preventable cause. A brief moment, overlooked, yet a tragedy unfolds. In an instant, a family is changed forever. A single candle flickers out, another life, another loss. The pendulum swings, the countdown continues, but these deaths are preventable. A chain reaction, choices, systems, awareness. The word preventable, it means we can change this. Lurking in the shadows, unseen and often unheard, is a force that silently threatens us all. What is this invisible force, relentlessly ticking away, claiming a life every 2 seconds? It's a cluster of conditions we collectively call cardiovascular diseases. Heart attacks striking without warning, strokes crippling and devastating, high blood pressure, a silent precursor to disaster. These conditions develop quietly, insidiously, often unnoticed for years. They progress often with no symptoms, masking their deadly intentions. Until suddenly, dramatically, it's too late. This isn't just one country's problem. It's not confined by borders or nationalities. It's a global pandemic, the world's leading cause of death, a grim statistic that continues to rise. The modern lifestyle, with all its conveniences and pressures, is fueling this crisis. Heavily processed foods, laden with unhealthy fats and sugars, increasingly sedentary habits, glued to screens and desks, and the ever-present chronic stress of modern life. Our hearts are remarkable engines, tirelessly working to keep us alive, but they're under siege, constantly bombarded by these modern-day threats. The tragedy? This killer gives us warnings, subtle at first, but increasingly clear. High blood pressure, often without any noticeable symptoms, high cholesterol, silently clogging our arteries. These aren't just numbers on a chart, they're distress signals, flashing red, begging to be acknowledged. But life is busy, a whirlwind of commitments and responsibilities. Doctor visits seem inconvenient, a luxury we can't afford. We think, it won't happen to me, burying our heads in the sand. But it does happen. To all ages, all backgrounds, everywhere on this planet. It's not just a disease of the old or the wealthy, a misconception that lulls us into complacency. It affects everyone, it is a universal threat. Men, women, rich, poor, city dwellers, villagers. From a CEO in New York, climbing the corporate ladder, to a farmer in India toiling in the fields, the story is the same, a shared vulnerability. A vital system pushed too far, strained beyond its limits until it fails, often without warning. The warning signs are there, if you know what to look for. We just have to listen to our bodies, to pay attention to the whispers before they become shouts. Ignoring them is costing millions of lives. A preventable tragedy on a massive scale. This is a crisis hiding in plain sight, an elephant in the room that we collectively choose to ignore. It's time to wake up, to pay attention, to take control of our health, because the next life lost, the next victim of this silent killer could be someone you know, a family member, a loved one, a close friend, or you. The silent killer is closer than you think, lurking just around the corner waiting for its opportunity. Let's talk numbers. Nearly 18 million people die from cardiovascular disease every year. That's more than the population of the Netherlands. Gone, every year. Break it down, 50,000 people every day. A stadium full, vanishing daily. Most deaths happen in low and middle-income countries where basic healthcare is a luxury. A simple pill in one country is a death sentence in another. The disparity is shocking, and it's unfair. This isn't just a them problem, it's an us problem. On your daily commute, you pass people with undiagnosed risk factors. The epidemic is woven into our communities, invisible until crisis strikes. Every 2 seconds, another life is lost. The numbers are relentless. But they're not just statistics, they're empty chairs, lost futures. We have the knowledge and tools to stop this. What we lack is the will. The stadium keeps emptying day after day. We can change this story, but only if we act. The clock keeps ticking. Will we keep looking away, or will we finally do something? The choice is ours. The time is now. Let's not waste another second. Statistics feel cold, detached, impersonal. They represent data points, trends, and probabilities. But behind every statistic, there's a human story waiting to be told. So let's talk about people, about lives, about the individuals who make up these numbers. David, 45, father of 2, a man with a family who loves him, ignores his headaches and fatigue, pushing through the day, dismissing the warning signs his body is sending. One morning he collapses. The culmination of ignored symptoms and mounting stress. Gone in an instant, leaving behind a void that can never be filled. Maria, 52, a vibrant woman, runs a market stall, her livelihood, her connection to the community, in a remote village where access to healthcare is a luxury, not a right. She can't afford a clinic visit, so she delays, hoping the symptoms will pass. A stroke leaves her unable to work, her body failing her, or care for her family, plunging them into uncertainty and hardship. These aren't rare stories, isolated incidents. They're happening everywhere, right now, playing out in countless lives across the globe. The young mother who dismisses her fatigue, attributing it to sleepless nights and the demands of motherhood. The grandfather who thinks chest pain is indigestion, downplaying a potentially life-threatening heart issue. The teenager already developing arterial plaque, setting the stage for future cardiovascular problems. Each case is a personal tragedy, a ripple effect of suffering, a universe of loss impacting families, communities, and future generations. But step back, and you see the pattern. A disturbing trend emerges, missed opportunities, chances to intervene, to prevent, to save lives. A simple blood pressure check for David, a routine screening that could have detected the underlying issue. Basic medicine for Maria, affordable treatment that could have prevented the devastating stroke. Health education instead of junk food ads, empowering individuals to make informed choices about their health. Every 2 seconds, the clock is ticking. Another story ends this way, another life cut short, another family shattered. We must see the faces behind the numbers, recognize the humanity in each statistic. We must feel the weight of these losses, the profound impact on individuals and communities. Only then can we understand, truly grasp, the true cost of inaction, the devastating consequences of neglecting preventative care. These are not stories of bad luck, random occurrences, unavoidable fate. They're stories of preventable loss, tragedies that could have been averted with timely intervention. We can change the ending, rewrite the narrative, create a healthier future, but only if we care enough to act, to invest, to prioritize prevention and access to healthcare for all. The faces are real, the people are real, their stories are real, the pain is real, the suffering is real, the grief is real. Let's not look away, let's face the truth, let's act now. Myths keep us complacent. Myth 1. Heart disease is a man's problem. False. It's the top killer of women too. Women's symptoms are often subtle. Fatigue, nausea, back pain, easily dismissed. Myth 2. I'm too young to worry. Wrong. The damage starts early, often in childhood. Habits in your 20s and 30s shape your future heart health. Myth 3. Modern medicine will fix it. But stents and surgeries are not cures. They're last resorts. Prevention is the real fix. Myth 4. Thin means healthy. Not true. Skinny fat is real. Normal weight, but high risk. Health is about what's happening inside, not just the number on the scale. Don't judge by appearances. The real danger is often hidden. Myths are comforting but deadly. It's time to face the truth. The crisis feels overwhelming, but the solutions are simple and affordable. We're not waiting for a miracle cure. We already have the tools. First, knowledge. Education is the foundation of change. Start with food. It's not about superfoods, but basic changes. Reduce salt. Eat more fruits and vegetables. Cut back on processed foods. These small steps could save millions. Next, movement. Our bodies are built to move. Just 30 minutes of moderate activity, 5 days a week. A brisk walk, a bike ride, dancing. It's free, and it works. Finally, basic medicine. Low-cost drugs for blood pressure and cholesterol save lives. In many places, these aren't accessible. Making them available everywhere would be a game changer. The solutions are proven. They're being ignored. We don't need new science. We need action. Prevention is powerful. The tools are in our hands. Will we use them or keep paying the price? The choice is ours. Imagine a world where the 2-second countdown is silenced. It's not a fantasy, it's possible with what we know now. Picture communities with walkable streets, healthy food as the default, and routine health screenings for all. Community health workers reach people before crisis strikes, offering education and support. The focus shifts from expensive hospital care to low-cost prevention. The economic impact? Huge. Less disease means more productivity, less financial ruin, more resources for progress. Some countries have already made this future real. Public health campaigns, tobacco control, salt reduction. They've proven it works. The blueprint exists. The challenge is scaling it up. This isn't just a nice idea, it's a moral imperative. We can build this world, but we have to choose it. The future is within reach. 18 million is a number too big to feel, but the cost of inaction is personal. It's your family, your friends, maybe even you. The empty seat at dinner, the lost memories, the missed milestones. Every death is a world of potential lost. Survivors pay too. Lives changed by disability, families burdened by care, the ripple effects destabilize generations. Inaction leads to quiet suffering and diminished possibility. The 2-second countdown isn't abstract, it's real. The choices you make today matter. Your inaction, our inaction, keeps the clock ticking. The cost is the future we're sacrificing. It's a price too high to pay. Don't let it be your story. The time to act is now. Don't wait for loss to make it real. This can't be just another story you forget. The responsibility starts with you, today. First, know your numbers. Get your blood pressure and cholesterol checked. Don't assume you're fine. Knowledge saves lives. Second, make one small change. Take the stairs, eat more vegetables, go for a walk, small steps add up. Third, use your voice. Talk to your family, friends, and community. Share what you've learned. Encourage others to get checked. Support healthy choices in schools and workplaces. Health isn't just personal, it's a community issue. Demand a healthier environment for all. The clock is ticking. Another life is lost. And another. This will only stop when we decide to stop it. Don't be a bystander. The power to change this story is in your hands. It starts with a single step. Take that step today. Lives, including yours, depend on it. Like, share, and subscribe. Your small contribution can save someone's life.